Assalamualaikum doctors. In this video I am discussing a recall communication. This is about Huntington disease. The task is that mom wants to go gene test for Huntington chorea for newborn baby because father is newly diagnosed. Okay. Discuss the method of inheritance, symptoms and onset. Spikes. Check the understanding. Ask her autosomal dominant inheritance. Can explain with diagram. Pause. Symptoms onset much later in life. No need to do the test now in newborn period. Regular follow-up. Immunizations and growth monitoring by health visitor and a nurse. Arrange meeting with a consultant if not convinced and summarize. So it is an autosomal dominant condition. It can occur in the babies. The symptom and onset is later in life. Okay, no need to do the test now in newborn period of life. So we explain that. So how can we get that? As usual, so Huntington disease is an autosomal dominant conditions. As usual, we start with that the IRCAP. Okay, here, Mrs. Salma, how can I help you? So she's telling, my father has diagnosed last month with Huntington disease and I did not know from where he got this. It is getting very, very worse. Very, very quickly, it is killed him, doctor. He forgot how to use the toilet. The genes doctor told us that the disease runs in the genes and I am really worried that my child have it and that is why I am here. I need to do some genes test for him to know whether he have it or not. So first we'll ask the concern. The mother is telling that the baby's grandfather has this disease. Now she wants to know that Ali has this genes or not. Okay. Then we tell that I'm really understanding. How do you feel? I'm so sorry for your dad. So we give the some empathy. I understand how you feel. I'm really sorry for your dad. I'm so sorry for what you are passing through, but I am really sorry we cannot offer this test for Adam. Why, doctor? Because actually it's Adam conditions. When we grow up, he is the one who decide whether he wants to do it or not. So Adam's condition, he will decide he can do it or not. He's just 5 hours, doctor. He cannot make such decisions. 14 hour or 14 day. Okay, it's a newborn baby. I understand, and that is why we cannot do this test, because as I have mentioned, it's his decisions. It is better to wait till he grows up and understand all about this disease and about these decisions, and he is the only one to take this decision. So he is the only one to take this decision. It is his condition, number one. Number two, it is later life it expressed. So it's not the time now we can do the test. Why you do not do it now? So we explain why we are not doing, why we are not giving. First of all, imagine with me, what kind of life Adam will gonna live if he waited the whole life for these conditions. Can you imagine with me? Do you think he will be able to enjoy his life? Do you think he will be able to go to school, learn? Imagine waiting for whole life for a disease will kill him. And I am really sorry to tell you that. So what type of life he will be do? And if he not that he will learn whole life, he will be wait, he will develop a disease. So we tell that's why it's when he will be grow up, he will understand the disease and it's his decision. He will take that he wants to do or not. Okay, doctor, I will not tell him. Actually, we cannot hide this information from him. I mean, once you know that he has to know. Okay, so what are you talking about, doctor? I'm his mom and I have the parents' right. Yes, you are his mom and we are totally respect that. But in this issue, Adam has to make his own decision. Adam has to make his own decision by himself. Okay, doctor. If you will not do this, I will be complain. I can understand how it is difficult time for you. But actually, if you complain, the court will not do anything as it is Adam's decisions. Okay. So if you complain in the court, it is Adam's decision, is totally right of the Adams, and we also want what is best for Adam. Okay, so doctor, what should we do? If you are insisting to know the odd, we can test for you, and if you have the gene, it means that Adam has the 50% chance of having the disease. If you do not have the gene, Adam will not get the disease. Okay, no, I do not wanna know whether I have this disease or not. I wanna enjoy my life. The same rule will be applicable for also Adam. It is his right to decide whether he would like to know or not, and his right to enjoy his life. So Huntington disease, it is an autosomal dominant condition, and it will develop later. So mother wants to know because his grandfather has Adam's grandfather has disease, so it is Adam's is present or not. We tell that we cannot do that to Adams because it is totally his right. He will, when adult, he will take the decision he wants to know or not after understanding the decision. Number one. Number two, it will be later life effect, so now not needed. Mother is insisting, mother, so we tell that what type of life he will do, like he will be frustrated, he will not enjoy his life, he will not learn, blah blah, everything we discuss. And mother telling, I will keep it as a hidden, confidential from him. No, once you know, we have to tell him like that. And if mother is insisting, we tell that you can do your test, because if you are positive, then 50% chance Adam has these conditions. So this is trusted website leaflet summary will give about Huntington disease, and thank you.